On that, in terms of then improving the effect of the plantar flexors and that muscle pump effect, how would that vary between then using the water, and particularly if we're trying to increase the capacity and potentially then get some hypertrophy and build size and increase strength within those muscle groups, which in turn could then enhance that effect and create greater pressures within the lower limb? How does that differ by doing the exercise in water, where we're reducing some of that load on the muscle, compared to then on land, where if we were to work and build that strength against gravity and against resistance, how does the use between the land-based and the water differ in terms of them being able to enhance the effect of that muscle pump?
I wish I could quote a lot of papers, but up to my knowledge, there are basically none really diving into this topic. What I can speculate is that you have direct and indirect effects. The direct one is, for example, what you have seen in the ejection fraction, so how much blood goes out, pumped by the muscle, thanks to the extra help of some compression coming from the water that is quite a significant compression, as we said before, up to 80 millimeter mercury. The indirect effect is the more mobility that you have into the aquatic environment that is allowing you to use your range of motion in a bigger way, for example, with the ankle. And it has been demonstrated in this case by more than one paper that the more you move the pump, the ankle, for example, in this case, the more blood you will have. So much that patients with ulcer usually have a significant decrease in the ankle range of motion, which is actually related to a significant decrease in the ejection fraction, so how much blood is pumped out. I think the aquatic environment offers the possibility of killing two birds with one stone, because, for example, you see in the obese or in the elderly patients, the possibility of doing exercises in the aquatic environment you never do on the land base. So talking with the population, again, even if you are not 18 years old anymore and you are maybe 80, there is no need to be afraid of the aquatic environment, because you can enjoy a nice pool simply standing up in the aquatic environment, enjoying movements you'll never be able to do outside the pool. And consider this also for lymphedema patients, because as we know, this vein week is of course dedicated to veins, but also lymphatics that goes together as a family affair, as it was described in a paper that was really entitled Veins and Lymphatics, a Family Affair. So we are talking about multiple benefits from the musculoskeletal system, as you were mentioning, Rob, but also to the lymphatic component, I would say.
Sergio, I have a quick question, okay? Now we know all this evidence-based and, the importance of this hydrotherapy in a chronic vein disease. I was just thinking, one of the things that that can affect the patient's compliance will be the financial aspect of it. So is there any study that you can share to us about the financial aspect of hydrotherapy?
Not that I know in terms of venous and lymphatics, and I like to point out that when we are talking about hydrotherapy today, we are focusing on the venous and lymphatic aspects, because there is a lot of literature related, for example, to the upper limb rehab after mastectomy. They did more investigation on this topic rather than on the lower limbs. But up to my knowledge, nobody is asking any fee to go to the seaside. So I would say that, of course, maybe you cannot enjoy the pool in this sense if you cannot afford to go there, which is not an impossible price, by the way. As we know, once you learn the proper protocol and you have a healthcare professional who is following you to be sure that you're doing the right thing, also for your cardiometabolic possibilities, because we also have to consider that we always have to check up on every patient before giving indications to do some physical activity. But if you simply go to the seaside, you can already enjoy the physical and very probably also some chemical properties, considering it's a salt water, that could be of benefit for you. But if you really think about the cost of going to the pool compared to the cost of many other treatments that our patients are exposed to, and if you consider potentially the healing speed following a proper rehab, well, very probably this will come out to be a cost-effective attitude.
Thank you, Sergio.
Okay. That's great. There's obviously, the building up of different aspects towards hydrotherapy in terms of the financial implications, in terms of the healing implications. And I suppose there's still a lot of research to be done in terms of, as you alluded to earlier, Sergio, if you're in different countries and they have different hot springs, what are the properties of the water in those hot springs to kind of, explore to see if it does have an effect. Also, our body is really complicated as well, in the sense that, different organs and different cells would, maybe optimal at different temperatures. So there's quite a lot for, I think, researchers to dive into. So Jennifer talked about the financial implications, but currently we're going through a pandemic. And what I was wondering is, do you still practice using hydrotherapy even in this current time?
Yes, the answer is yes, meaning that in my region where I live, there is these hot springs in the town of Abano Terme, where we created a COVID-free structure where patients can come. Of course, they are distanced. And also the Minister of Health recognized the possibility of keep on doing that, because in reality, with the proper distancing, there is no issue related to the topic. We have to get away from the concept that COVID can swim around the pool and get to you. Of course, it's more complicated than before. Of course, when we are talking about hydrotherapy, we are not thinking about whirlpool with 4 people enjoying a cocktail together. We are thinking about a pool that has proper water inside with all the requirements to allow standardized exercises in it. And in this way, there is no issue COVID related. But of course, we had to restructure the situation in order to be sure that all the patients who are accessing the pool are COVID free. But this is for whatever kind of activity we'll do in the future, I think, in this new world. It's really simple. They have a fast swab and then they come in. So in terms of protocols, they are doing this twice a week for 50 minutes each. So it's something that is also good, I think, and I'd like to ask Rob about this, for their general musculoskeletal system health. So at the same time, you really kill multiple birds, not just 2 with 1 stone, because you are also keeping them trained. And indeed, we are going to publish another publication showing the impact, not just on the lower limb varicosities, but also on their cardio functionality. That is, of course, another measure of health. So I would ask Rob, how do you perceive a protocol that is engaging this population twice a week for 15 minutes?
Like I think you mentioned there, some of it is trying to tie into the individual and their preferences, but we know particularly in the UK, as you said, mentioned trying to address multiple aspects of health and disability within the pool can be a good way. We know that particularly in the UK, there's roughly 1 in 4 people suffer with a musculoskeletal problem, which can contribute to further disability, physical inactivity, sedentary behaviour, and obesity, which has been associated then with poorer vein functioning. And so, as you said, it's a specific kind of protocol itself can help in terms of then we know the specifics of the effects that can have on the vasculature and the effect of the veins. But also, if it's a medium and a way to help improve general physical activity and exercise within those and work in the cardiovascular system, it can also help to reduce the burden of these other contributing factors to vein health. And some of it, I think, in terms of that setting is utilising, that method of trying to increase activity in a different way that people may not always be so at the forefront of their mind. It's a different way where they can work those, they can work and improve their vein function, but also their cardiovascular, and looking at the wider picture as well as the many other comorbidities they may have at the same time, and trying to address some of those and improving the overall well-being and the physiological functioning of them as well. And which could also, as you mentioned, be an effective way and increase, because within the UK it's variable in the access to these facilities. Some are funded through the NHS, but not so many, whereas many of them are more private funded. And we know that generally the lower social economic people or status within the UK generally have to contribute more to the burden and the prevalence of these non-communicable diseases within there. But if we can, look at ways to then increase resources that are addressing those and reducing some of the barriers. You mentioned that the sea, often in the UK, it's not the warmest, which is definitely not going to help to entice people towards the coast. And if they're more inland, but actually then we can, as you mentioned, kill multiple birds with one stone. So we can affect not only those who already have some venous disease, but also try and be preventative with that as well.
Sure. And I think this is great what the colleagues from the Leg Club group have organized in terms of raising awareness with the public about the potentials of hydrotherapy, because in reality, every single pool around the world is actually a potential health center for what we are saying. And they are not even realizing, the pool owners, what great benefit they could provide, also co-working with the health institutions, finding probably a way also to diminish the cost burden, because this is really becoming a prescription at the end. So even government could start thinking about the use of water to reduce the socioeconomic load of this disease. Consider that now in Italy we are doing a study to evaluate with the ministry also the cost saving that you can have having proper graduated compressions in healthy subjects subjected to long standing up hours for work. So in the same way, to go back to Jennifer, an interesting thing could be reaching out more and more to the pool centers to co-work with proper pricing and proper activity, guided of course always by health professionals, to increase the benefits for our patients at the end.
Sergio, okay, so if I will be utilizing hydrotherapy and compression therapy, can you give me a sample treatment plan? Let's say if I will talk to my patient, how many times a week they will go to hydrotherapy, and how many times I'm going to do compression therapy. So can you tell me more about it?
So based on our study, the protocol, as I was saying, is twice a week, 15 minutes. And after 5 sessions, so 2 weeks and a half, you will have 400 mils of reduction in lower limb volumes and up to 4 degrees of improvement in the ankle range of motion. And the symptomatology will drop down from 7, where 10 is the maximum, down to 3. So what I usually explain to the patients is that they have to learn the protocol. So they come just once, they learn it with a physiotherapist or a health professional, and then they come back for redoing a checkup control that they can do the protocol properly, which is pretty simple. Everybody can do that. Usually in between the sessions, they use graduated compression stockings, but in reality, they could also be a little bit more not compliant, meaning that what we have demonstrated is that in terms of lower limb volume control, for a couple of days, you are remaining with the same volume. So at the 3rd days, you tend to have the feeling again of the lower limb. So this will also allow you to increase the compliance of your patients, because usually if you say to a patient, use compression every single day, they are a little bit reluctant to start with the therapy. But if you explain to them that there is a combination of the two, usually they enjoy more compression. And then they understand that graduated compression stockings per se, if properly prescribed, are extremely pleasant to be used. The fact that compression stockings are usually considered not pleasant to be used in 67% of cases, according to the literature, is because the prescription was done in a bad way by the health professionals. So there is a lot of improvement there also in terms of compliance of the graduated compression stockings use. So the take-home message is keep on using your compression. If you will go to the pool twice a week, you will be less forced to use it every single day, but still you will use it. And in reality, spontaneously, they will use compression every single day because they will understand the benefit of that at the end.
So I'm going to throw the spoon in the cup of coffee now, because I've been listening to all your different perspectives. And I'm very interested in what Rob had to say in terms of, you know, hydrotherapy within the UK, and especially during this current pandemic, where a lot of the leisure centers and a lot of the pools that would be available will be closed because of government guidelines and, you know, to combat coronavirus. But at the same time, there's also a number of issues that, you know, were quite interesting whilst you were talking that I was quite aware of. Like environmentally, if we are filling these pools up and we are having patients that are using these pools, and then we have to drain the pools and clean them and then refill them, environmentally, is that sustainable? Is that, you know, is it a good use of water when we can be using, say, other forms of exercise or alternatives that could provide or yield similar results? I think that's an interesting point that maybe we should discuss. So, Sergio, what do you think?
Yeah, this is a great question because it offers us a possibility to clarify the distinction between a pool addressed to whatever kind of patients affected by venous lymphatic disease and the patients affected by the latest stage, that is, of course, ulceration. In case of ulcer, you can, of course, still do aquatic therapy, but you will require a dedicated, I wouldn't call it pool, it's more like a little basin in terms of volume that is addressed just to that patient. So the amount of water that is in there is not so far bigger than the amount of water we use for having a normal bath at home. So that is a totally different game in terms of kind of pools you're using for patients with an ulcer. That likely enough is 1-2% of the population according to the literature, compared to the water you will use in a normal pool, where you will find, no matter what, even in every single day, even before COVID, of course, at least 50-60% of the population having some form of venous hypertension, ranging from telangiectasia all the way to a healed ulcer. So don't forget, I would say that whenever we go to the pool, independently by what pool it is, we have 60-70%, up to 84%, if we are looking also at the telangiectasia as a form of venous hypertension, of patients with venous disease in a sort of way. So the only thing is to be sure that if you want to use the pool for your ulcer patients, you have a center that has a dedicated basin that is not a pool, but a basin.
Yeah.
Okay.
Okay. So I think there's, you know, we've touched on the evidence, and I think we all kind of agree that hydrotherapy is very useful and beneficial for our patients. In terms of future directions, I'll go back to you, Jennifer. Do you think this is something you would now introduce into your practice?
Definitely yes. So after hearing Sergio and Rob, and I will definitely incorporate this in my practice.
Great. And Sergio, just to sum up this discussion, what do you think the future direction for hydrotherapy will entail?
Well, I hope it will change a little bit the direction that it has taken so far, meaning that so far a lot of people have been enjoying the water environment. If you look at the Global Spine Summit data, trillions of dollars are spent every single year in the aquatic environment, but without significant investment in increasing the evidence-based data behind that. So I truly hope we will stop being like little ducks, as I was saying before, just enjoying a bath, and we will be more like health professionals and properly informed patients who will collect the data and present the data properly to explain all the physical, chemical, and thermal properties that are there. So if you're asking what my future directions will be of course of continuing prescribing a standardized and reproducible protocol to our patients, and even more than that, to investigate chemical, thermal, and physical properties of that. And I hope that the future will be also being all together, enjoying a nice bath in my region at the first opportunity of traveling again.
Great. So thank you for joining us. And I'm sure we've left a lot of food for thought in terms of hydrotherapy. And Sergio, Rob, and Jennifer and myself will be available to answer any question.
And I look forward for having some more coffees and thoughts then, not just food for thoughts, and to enjoy also the Bulgarian collaboration we will have with Lindsay Leg Club Foundation during the Bain Week. So thank you so much, Abdul, for hosting this outstanding reunion. And thanks so much, Jennifer and Rob, for the professionalism and niceness.